Assalamualaikum warahmatullahi wabarakatuh. Good morning, my name is Eva Miranda Fitri from Syekh Kuala University. I will presenting my research about the prevalence of auditory function examination in children suspected hearing loss at Dr. Zainul Abidin Hospital, Banda Aceh. Hearing loss is one of common abnormalities in children that should be suspected as one of the factors causing speech and language disorders in children. Many pediatric patients came to outpatient clinic with the complaint language and speech development were not appropriate with the language milestones. In the other hand, this condition also have another disorders, such as expressions or receptive language disorders, cerebral palsy, autism, and so on. So, suspected hearing loss must be proven by examination of hearing function. Normal hearing. Previous studies in Greece, 68% of speech delay had normal hearing. The same thing was said by research in Hasan Sadikin Bandung Hospital. 24% of children with speech delay had normal hearing. The hearing loss result. CDC reported that children with hearing loss is detected in 1.7 from 1,000 live births. And Riskesdas also reported that there were 0.11% of children with congenital hearing loss. Hearing loss with late intervention will affect the language ability and influence the cognitive functions, behavior, and intellectual. Moreover, in language disorders with normal hearing. This is encouraged to perform the result. Therefore, we want to investigate the prevalence of auditory function examinations in children suspected hearing loss at ENT Outpatient Clinic, Dr. Zainul Abidin Hospital, Banda Aceh. The method is a retrospective descriptive study with consecutive sampling techniques. Data was collected from medical records. The samples were examined with OAE, BIRA, and ASSR from January 2018 to July 2021. Then, inclusion criteria were patients who had a result of hearing function examinations and the result was sensorineural hearing loss. For the exclusion criteria, patients who have not completed a series of examinations and patients with conductive or mixed hearing loss. This research got to 103 patients. We found that gender of patient is more common among male to female with ratio 1.8 to 1. This result in accordance with the Wijana found that male was more common to female. Based on previous study, many factors could play a role, including X chromosomal mutations, change in the structure of the peripheral auditory pathway, and the size of the cochlea in males and females. In this study, the age above 36 months was dominant age group, followed by age group 24 to 30 months. Recommendation of GCIH: hearing loss should be diagnosed before 3 months old and interventions before the age of 6 months. Mother's educational and occupational status are also evaluated. They are mostly college graduate groups and housewife group. Lack of knowledge about early detection, wait and see the development, which is often shown by parents who are too late to seek hearing examination or other treatments. There are 11% other congenital abnormalities such as cataract, heart disease, thyroid disorder, Down syndrome, and cerebral palsy. Multiple abnormalities were found in 6 samples. Some of disorders indicate a syndrome, like a congenital rubella syndrome. Family history is one of the risk factors for congenital hearing loss, but the evidence of relevance is low. We found 5.9%. From the history of birth, more children were born spontaneously. There is not much study that proves a direct relationship between the history of the birth and congenital hearing loss. There are several risk factors in this study. We found not crying immediately is more common. However, 45% remain unknown. In this study, on the item of history of thoughts, hyperbilirubinemia, and not crying immediately just based on anamnesis, the parents couldn't show the result. This study found that 63% had no hearing loss and 37% with normal hearing. The sample with profound hearing loss was 86% and 92% with bilateral hearing loss. Hearing loss in children commonly bilateral profound sensorineural hearing loss, while mild and unilateral hearing loss often ignored by parents due to slightly language disorders, the same reported from India and Purnami study. The conclusions are, suspected hearing loss in children have to prove with hearing examinations early. If the result is normal hearing, we also must doing early investigations and explore the other disorders. Early detection and efficient management are essential to development of normal language, behavior, cognitive, and psychosocial function. Children with hearing loss need rehabilitation and intervention soon. So, stakeholder and government role are needed to help and improve hearing screening management in Indonesia, especially in Aceh. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.